Anybody have any questions? Cardiovascular or systemic infections means that the organisms get into the blood. So here's a list of organisms, because it's pretty easy for organisms to get in the bloodstream. Right? They can start off someplace else and then make it into the blood. Right? So here's a list of them: Acinetobacter baumannii, Streptococcus pneumoniae, Haemophilus influenzae, Staph aureus, Salmonella, right? Enterococcus, like tuberculosis. Tuberculosis is not an infection of just the lungs anymore. It can infect every single tissue of the body. Okay? And so it's pretty interesting to think about, because you can have a boil and then the organism can move into the bloodstream of any other barrel. This happens more dramatically in diabetic patients. And so we have to be careful. There are a lot of diabetic patients. If you want to have a job for life, go into endocrinology or go into disciplines that actually help diabetic patients. Because those guys, first of all, they're mostly non-compliant. They don't want to follow the rules. Right? My mom was a good example of that. Mom, you can't have cake. Okay. And then you come to her house and what does she have? Cupcakes. And where does she have them? Under her pillow. Mom, you didn't think I was going to find them? She goes, oh, I didn't know they were there. And then you open her closet and there's ding-dongs and all kinds of stuff in there. Mom, well, it was for a snack. I'm like, you can't have these things, right? But they do that. Christy, do you have a question?
Yeah, I was going back to TB, where it's most commonly found in jails and in homeless population. Why is that?
Because if you have one individual, a lot of times they aggregate really close to each other, and therefore they're more likely to spread within that population.
Okay.
Good question. I see a test question coming out. Yeah. You could write that.
Yeah.
Okay, so the old term for infections of the blood is sepsis. People still use it. They still use the term septicemia. I would like people to become much more descriptive of what they're talking about. So instead of saying septicemia, can we say bacteremia if it's bacteria? Can we say parasitemia if it's a parasite? Can we say viremia if it's a virus? Can we say fungemia if it's a mold or a yeast, right? Can we be a little more specific? Because we treat them all differently, right? You don't treat them the same way. Bacteria are treated with antibiotics, but nothing else is treated with antibiotics, just bacteria. And so it's pretty easy to think about. On the average, we have about, the M stands for 1,000, so we have 500,000 new cases in the United States. So most of those are going to be individuals that are hospitalized. Remember, bacteria will cause problems in a hospital, viruses will cause problems in the common population. Okay? There's about a 25% mortality rate. 10% of the patients who have developed sepsis die because of some underlying comorbidity. Right? They have diabetes, they're morbidly obese, they have chronic kidney disease, there's just a bunch of things, right? And so it's a problem with those individuals. It's the 13th leading cause of death in the United States, therefore, it doesn't get a lot of attention. I know that when I left my last job, we had 13 antibiotics sitting in our kind of pool of drugs with 13 of them. And they were not going to be taken to clinical trials because it's expensive to do that. And you only have exclusivity for 7 years. That means if it gets out of the market in year 4, you only have 3 more years to make a profit. Right? And so if it costs you, I don't know, $300 million to take it to clinical trials, and you're only going to make $200 million, that's not worth it to pharmaceutical companies. They can make a lot more money on things like Viagra, or cardiovascular diseases, or hypertension medications, right? Or medications that will help your hair grow back. because it's pretty interesting. The cost of bacteremia in hospitals is about, if we take just the low number, $5 billion. That's way too much. And so we need to get that under control. So a lot of times the sepsis cascade, you have an infectious agent that gets into host tissues, it begins to grow. The immune response gets initiated, neutrophils show up, you have a cytochrome release, inflammation starts to appear, coagulation starts to form. And if we don't get the infection under control, the patient will go into septic shock, the kidneys will go, and the liver will follow. And then we have multiple organ dysfunction syndrome, and the patient will die. This is why a lot of diabetic patients undergo dialysis. Their kidneys are already a problem. And if we just let them sit there, the liver will go and then they'll die. Okay? And some people are not very good candidates for kidney transplants. And nowadays, you know, the very wealthy people are getting first dibs on kidneys because when they become available, the wealthy people can buy them. And that's happening even though they might not want to think it is. Somebody told my mother that she was a good candidate for a kidney transplant. She was not. She was never going to get another kidney unless one of us gave her one of ours. And I would not let that happen. I told my brother and my sister, you are not allowed to give her a kidney. We never did cross-typing matching because my mom was not a compliant patient. She was not going to change. Therefore, there was no reason to give her a kidney if that kidney was not going to last in her. Those are the difficult decisions you have to make sometimes when you are the medical fiduciary for a family. I don't have a problem making those. Okay. My dad was really sick with gastric cancer. He was dying, and the nurse came in to feed him. I'm like, no, do not give him any more food. It's time. So I'll let my dad pass. We took out the NG tube because he wasn't going to come back from where he was. People die very differently. Some people just pass away in their sleep. I hope that's the way I go. Mm-hmm. My dad was dramatic. He was doing the guppy thing. You know what I'm talking about?
Oh, like the last breath kind of thing.
But it lasted for an hour. That's dramatic.
You remember that movie with Michael Keaton and Nicole Kidman?
Which one?
I don't remember the name of it, where he had cancer. And
I don't remember watching that one.
Yeah, it was
The one that I remember being very specific was Philadelphia, which is an older movie. You've probably never seen it, right? But it had Tom Hanks in it. It's a great movie if anybody wants to watch what it really looks like to die of AIDS and the diseases associated with AIDS. That's the movie to watch.
Gia.
Huh?
Gia.
Gia was good also.
And it was based on.
But I couldn't get over the fact that Angelina Jolie was so beautiful, and I couldn't really pay attention to the disease. I'm like, she's really pretty. So, you know, it's just the way it is, right? But, and Gia, the model, the real Gia, is absolutely.
Yeah.
You can't say those things anymore because people get all excited. It's just the way it is. So, 50% of all cases of bacteremia are caused by gram-negative rods. You should know that for the exam. I'm going to ask, what is the principal etiology for bacteremia? And it's going to be gram-negative rods. Other etiologies are CNS. That does not stand for the central nervous system. In microbiology, that stands for coagulase negative staphylococci. That's all the staphylococci, that is not Staph aureus. Okay? Staph aureus, Enterococcus species, and the fungi. The numbers of sepsis, the number of bacteremia is expected to rise for the following reasons. The larger numbers of immunocompromised patients in the population. That's not just AIDS patients, that's cancer patients, that's autoimmune, that's Crohn's people, that's all kinds of different people. Right? Secondly, the more frequent use of invasive procedures or devices, right? So this is dialysis, right? But it's also having breast augmentation, having a facelift, having a tummy tuck, all those things, right? Well, it's pretty interesting because of the GLP-1s, I think a lot of the problems with that is gonna go away. So if they start to see, to me, we should not make them so expensive. I mean, they are really expensive. I mean, even if you have insurance, some of the more prominent, like Zepbound and things like that, they're like $600 a month. Who can afford that? So we have the magic bullet that we have been asking for obesity, for diabetes, for chronic kidney disease. It's not going to cure chronic kidney disease, but it's going to make it easier to manage. We have the magic bullet. We're not making it successful.
What's the magic bullet?
GLP-1.
Okay.
There's a bunch of them.
Yeah.
Monjaro, Ozempic, Zepbound. I mean, I don't know, there's a bunch of them. So it's pretty cool. And so it's pretty interesting. The greater availability of life-sustaining technology. Nowadays, we can take a premature infant who was born 3 months early. We can nurse that individual to perfectly good health and have a perfectly great life with no problems. And that's pretty cool. That's another very rewarding field of nursing if you want to go into. However, if you lose one baby, I wouldn't be able to come back from that. I'm like, hell no. Put me in podiatry from now on. I want to go work with feet. Right? I'm telling you, I mean, it's just crazy.
Yeah.
So, I mean, I don't want to be involved with anything that a baby gets. No.
Yeah.
Put me in gastrology. Put me in something I have to deal with poop all day long. I'll do that. But, no babies for me. No. And hospice, I think I could handle it for a little while, but after a while, it would just drain me. But that is a very important field. People who are dying need to have their hand held for one last time before they go. Touches are important. I'm telling you, all nurses, compassion is what's missing from nursing. We have all the technology, we have all the life-saving abilities. What we tend to lack is compassion. Know people by first names. Do not call the patient at 309. Okay. Don't say the amputee in 100. Call them by their name. I think there was a movie by that, Call Me by Their Name or something like that. Had a different storyline than we were talking about. Just kind of, people are important. There's a reason, Lisette, I know there's a woman here. And I knew it, third day of class. Like I said, because y'all are important. And I'll see you 10 years from now, and I'll say, oh, Miss Brito, how are you? And you're like, who the hell is this guy? I said, me, pray me. And you're like, you got old. I'm like, I'm already old. So, the higher infection rates of antibiotic-resistant bacteria were already there. And then the increase of proportion of patients at the extremes of age. In this country, it's older. In other countries, it's younger. So, it's really interesting to me. Ladies, I don't know how you're ever going to find somebody to date. Right? Because the young guys stay home and play video games all day long. And how can you go on a date if they only want to play video games? I don't get it. So, you better learn how to play video games.
Or just stay single.
Oh, well, you can do that also. And you all will be in a place once you have your place in your career. You're going to be independently able to do whatever you want. You're going to make a nice salary. You'll make more money than I do. Dental hygiene start at probably 120. That's just a start. And depending on where you are, you can make more. You could be a nurse and make 60,000 a year working half a day. But you have to do things that are hard. I want to do the easy stuff. Give me the poop. Give me the feet. Give me those things, right? That I don't have to like worry about, people dying. So here it is. This is the last thing we'll talk about today, and then we'll take a break. This is Klebsiella pneumonia. This is carbapenicillin-resistant Klebsiella pneumonia. Right? This is an infectious agent that has become resistant to our last line of defense, the carbapenicillins. They don't work. Now, this organism is unstoppable, right, with current methodology. We can use tuberculosis antibiotics, and they will work. They are very toxic. So you can see infection wards like intensive care, medical, surgical, pediatric, transplantation wards, burn units, tumor. You see the different ways that these infections can be there. And then infection sites, blood, sputum, wound secretions, chest, and abdominal dropsy, urine, bronchial secretions, catheters, bone marrow, cerebral spinal fluid, and bile. Unfortunately, the medical profession, the medical industry has become a big business, and it cares more about making money than making people better. So they want people to learn to catheterize themselves. That's not gonna work. Okay? Will you turn it on for a minute?